A new warning today as potentially deadly respiratory diseases and viruses spread across the U.S. A former FDA commissioner is telling parents not to let their guard down.
For parents who have children who have an upper respiratory infection, many times they're testing them, finding out it's not COVID, and feeling relieved. I think they still need to be vigilant that it could be RSV, it could be early flu. So if you see progressive symptoms, seek out help from a doctor. There are treatments that are available that could help children with RSV.
All right, joining us right now, Dr. Elizabeth Clayborne. She is an emergency physician at the University of Maryland Capital Region Medical Center. Doctor, so good to see you.
Good to see you, Fred.
So we are indeed seeing cases of RSV and flu tick up across the country. COVID-19, of course, is still out there as well. Pretty scary time for a lot of parents. So as a parent yourself and a doctor, what do you recommend are the best ways to keep our kids safe right now?
Absolutely, Fred. I think that parents need to remember that we really are having kind of an unprecedented season for both RSV and flu, and that we're seeing them earlier in the year than we expected. And we think that's because kids really have largely been either out of school, at home, or fully masked. And this is the first, winter season that we're going into where a lot of both adults and children are interacting, and we're starting to see a rise in RSV and flu already. And that means that a number of children are starting to get sick and very sick unexpectedly. And when these illnesses take place, sometimes they need to have an emergency intervention, such as a breathing treatment, steroids, and possibly admission when they get into respiratory distress. So what I tell a lot of parents, because I know it's very nerve-wracking to get worried about every cough or sniffle that your kid has, is to just prevention is the best option. So make sure that you are hand washing, you keep your kids at home if they're sick, and certainly make sure that you're vaccinating both flu and COVID when available.
And then what have you been seeing at your emergency room?
Yeah, so we've definitely seen it uptick in the cases of RSV in particular. I've been seeing quite a few infants, those under 3 months even, that are getting RSV. And that population is particularly susceptible because it's hard to tell when they get sick. They don't have necessarily the same signs of symptoms such as cough, or they can't tell you that they're not feeling well. They
Yeah.
sometimes will just refuse bottle feeds or breastfeeding, or other times just have a reduction in their urine output, meaning they have fewer wet diapers. Those kind of signs are things that parents should pay attention to that may alert them that an infant is indeed more sick than they might realize and need to be seen in the ER. And then because we have had a shortage in nursing staffed beds, it is very hard to place these children. So at my hospital in particular, we tend to board pediatric patients. We are not a pediatric hospital, meaning we have to transfer them, and it has been very hard to find available beds. And so our wait times in the ER go up, and these sick children have to stay with us for several hours.
Oh my goodness, what you just described a little bit earlier about all the kids under 3 months, that's exactly what I experienced with my twins when they were just 1 month old and they got RSV and they were hospitalized. It was incredibly frightening. And then here I understand now they're 10 now, so everything's cool. We're out of the woods, so to speak, on that one. But then I understand you have just dealt with that with your 2 and 4-year-old kids getting RSV. Knew how to identify it, but what did you experience as a family and as a doctor with your kids on trying to get them the necessary treatment? What was your journey like?
Yeah, it's always hard as an ER doc mom because we always worry about either doing too much or too little. And so most ER docs are not going to take their kids to the emergency department unless it gets pretty serious. And unfortunately for my 4-year-old, about 3 weeks ago, it got to that point. She actually did have RSV, and she really had a difficult time breathing, and she got into what I call respiratory distress, where I just really couldn't get her breathing under control at home, even though I had a nebulizer machine at home. I knew that she probably needed some steroids. I wanted to make sure she had not developed a pneumonia, and so I had to take her to the emergency department. So I understand a lot of parents don't have my knowledge, they don't have my skill set, and they certainly sometimes don't even have the same access to healthcare facilities the way that I do. So I feel so fortunate that I was able to take my daughter in and she recovered, and they're both doing well now. But it is scary, and so that's why it's important to stay vigilant and pay attention to the symptoms. When they start to worsen, you can call your pediatrician or your doctor if you're worried. And then if you get to the point where you feel like they really are having a hard time breathing, they're breathing very fast or belly breathing, go ahead and head to the emergency department.
Yeah, like right away. Do not hesitate. Don't ignore all of those signs that you described. Dr. Elizabeth Clayborne, glad your little ones are on the mend and doing well. Great to see you.
Great to see you too, Fred.
Thank you.